歡迎大家嚟到今日。
Welcome to today's press briefing. We have two doctors on stage, Dr. Zhang Shuquan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Zhang will first brief you on the latest situation. Good afternoon. Last night, we recorded 1,161 positive cases. 8 are imported cases. The remainder are local cases. The majority of patients with mutant carrier strains are Omicron, and a small number of them are Delta. The testing is still ongoing. And among these cases, we've identified patients involved in family clusters because they gathered during the Chinese New Year. Many of them had the mixing of multiple families during Chinese New Year, dozens of them. As for the remaining cases, they involve housewives, elderly people, retirees. Many of these cases have no other connection apart from visiting markets and shopping malls. So I appeal to everyone once again to stay in and avoid mixing of families. And if you want to do grocery shopping, please reduce the frequency and try to buy bulk at once. We are concerned about outbreaks at residential care homes for the elderly. In some elderly care homes, some people today will have to be sent to quarantine. One is Yanwick elderly home in Tai Kok Tsui. An elderly patient tested positive. This elderly resident lives in a single room, and some cases will have to be sent to quarantine. The other is Arenis Church Wang Xiu Ting elderly home. It is located in Sha Tin, Sha Kok Estate. A resident and a staff member have tested positive. So it is an outbreak, and about 50 residents living on the first floor will have to be quarantined. The other is Wen Yun elderly home, and Dr. Lee will be speaking about it in a moment. An elderly patient was confirmed and succumbed to the disease. And again, residents in this elderly home will have to be quarantined. And Lei Wai Siu K elderly home of Yan Chai Hospital is another involved elderly care home. Care worker has tested in positive. The other is Fu Hong Wui, which is a residential care home located in Ao Tau Kok. 2 cases have tested preliminary positive. One is a staff member, the other is a resident. So again, some patients will have to be quarantined. Since the start of the 5th wave, over 10 residential care homes for the elderly or for the disabled have experienced outbreaks or mini outbreaks, and staff and residents will have to be quarantined. So I appeal to everyone once again to take this opportunity and get jabbed as soon as possible, especially for elderly residents and workers of residential care homes. Dr. Lee will brief you on the hospital authorities' situation. As at 9 a.m. today, in the past 24 hours, we recorded 414 reportable cases. 121 patients have been discharged. Altogether, 13,436 patients have been discharged so far. 1,990 patients are currently hospitalized in the North Lantau Hospital Hong Kong Infection Center, the HA Infectious Disease Center, and the CF facility at Asia World Expo in 14 public hospitals. We announced last night that a 73-year-old male who is a chronic patient was hospitalized in the observation ward of Caritas Medical Center. He was in dire condition at the time of admission. He received suscitation and he succumbed to the disease at 4:45 a.m. last night. The case would be referred to the coroner's court. The case number is 17498. In September, he received 2 vaccine jabs. The other case we announced in relation to a critical case, we made the announcement last night. Another case involving a 76-year-old male at the Caritas Medical Center. He was admitted to observation ward. He had the pulmonary disease, and at 4:45 a.m. This morning, he succumbed to the disease. The case number is 16741. He did not receive any vaccine. We'd like to send our condolences to the family members of these two cases. We feel disheartened, and so far 207 patients have met their demise at public hospitals. At the moment, we have 2 patients in critical condition and 4 in serious condition. The first critical patient is 14814, a male patient in his 80s. He has not been vaccinated. Another case number 16485, a 57-year-old male. In August last year, he received vaccination. And let me correct, there are 3 serious cases. A 50-year-old male patient 14930. In last August, he got jabbed. And a 56-year-old male, case number 15540, hospitalized in Tuen Mun Hospital. He received 1 jab. A 77-year-old female patient 13400 who has not been vaccinated. In relation to the critical and serious cases and patients who passed away, you may notice that they have not been fully vaccinated, or some of them haven't vaccinated at all. So I appeal to everyone to get vaccinated and receive the 3rd dose as soon as possible, especially elderly people. Another appeal I'd like to make is that in face of the surge in the number of confirmed cases and preliminary positive cases, many patients in the past few days have been visiting A&E unit to confirm the testing results. This has posed a burden on the system. It is also affecting our healthcare services. So I appeal to everyone that if you are experiencing mild symptoms, please don't go to the hospital. Instead, please contact the family doctor or approach other private healthcare organizations. Next, if you test positive, please try to ask your family member or courier service to submit the deep throat sample for confirmatory test. Please avoid going to the A&E unit, because if you go there, you may have to wait for a long time at the triage station, and this may not help speed up the process of hospitalization. In light of the rapid growth in the number of confirmed cases, arrangements will have to be made for patients to be sent to the suitable hospitals or community treatment centers, and we may need to consider a number of factors such as age and physical condition. Some patients may have to wait for a few days before they are sent to the appropriate hospital. But the majority of patients at the moment are experiencing only mild symptoms or they're asymptomatic, so I would ask them to be patient and wait at home. Now, starting from today, members of the public who are waiting in the community to be hospitalized, we have a hotline service, and our colleagues would contact members of the public who have waited for a long time as a priority, and if necessary, provide assistance. Please understand that the public hospital at the system at the moment needs to take in confirmed cases as well as process a number of confirmatory tests. Our capacity has almost been reached. We will further amend the admission criteria. For confirmed cases, if there are no exhibition of clinical symptoms, there is no need to wait for 10 days. And after being discharged from a hospital, they can stay home for medical surveillance. There are also 500 additional isolation facilities at the Penny's Bay Quarantine Center, and these places will be filled up very soon. We are going to operate more community isolation facilities. We will also deploy additional manpower to help out. If necessary, we will gradually reduce the service capacity for non-urgent cases. The public hospital staff are making an all-out effort to take care of COVID-19 patients. At this critical juncture, I would appeal to everyone in Hong Kong to to work with us and get jabbed as soon as possible.
And we'd like to call on those retired healthcare workers. Please try to help us because we need a lot of manpower at different facilities. And also, we need people with healthcare experiences to man our hotlines. And at the same time, I would like to also talk about those who are preliminary confirmed. Well, there are people working in public hospitals who are preliminarily confirmed. This includes a doctor at Kwai Chung Hospital, 10 nurses, and they work at different hospitals, including Eastern Hospital, Princess Margaret Hospital, South Kwai Chung Clinic, and CMC, Kowloon Hospital, QEH, Tim Mun Hospital. 19 patient assistants and administrative personnel, technicians, physiotherapists, nursing students, and contractors have also contracted the disease. They work in different hospitals. For example, Yanchai Hospitals, QM, and CMC, blood transfusion centers, Children's Hospital, QEH, United Christian Hospital, Tim Mun Hospitals, etc. And arrangements for isolated treatments have been made, and also the places where they work have been disinfected, and they have been donning PPE. They have not come into close contact with other staff. However, some of these staff members have taken meals together, so a dozen of them are now classified as close contacts. And also, a patient assistant has been discovered that his preliminary positive, and he's taken care of. And the 62-year-old male patient is also confirmed. We are now trying to find out whether they are connected. This is in a psychiatric ward, so this psychiatric ward is not receiving new patients. And also for QM and Princess Margaret hospitals, there are also cases, and 50 patients' appointments have to be rearranged, and the places involved are disinfected. As for QEH, previously a ward was closed and now is started receiving new patients again. So I call on you to don your mask and not to take off your mask while talking to people. And also we have at Kwong Wai Hospital, CMC, Prince of Wales Hospital, and Ritchie Hospitals, we have discovered cases, and 30 patients are identified as close contacts, and they are at different hospitals, including Ritchie Hospitals, QEH, etc. So now it's time for reporters to ask questions. The lady in black. I'm from Now TV. First of all, I would like to follow up on what you said just now. That is about the critical and serious cases. Now, for these cases, some of the patients have been vaccinated. Can you tell us what's the vaccines and how long ago did they take the jab? And what chronic diseases do they have? Now they've been vaccinated, but they are in critical and serious condition. So do you think that this will make people less willing to take the jab? And also, you are saying that family members should help the preliminary positive cases to handle their throat saliva samples. Now, if their rapid test is positive and if they do not have symptoms, do you think it's okay for them to stay at home? It would affect their family members. Does it mean that the risk is very low if they have no symptoms? But as some experts say that if they do not have symptoms, maybe they don't even have to be hospitalized. And also, a reporter has been confirmed. He has been coming to this press briefing a number of times, and he or she has also been to a stand-up of event of the chief executive. So do you think the other people working there should be quarantined? Well, as for death cases, we have 2, and they have been suffering from chronic diseases. For 16740, he's suffering from cancer. One of them has taken 1 jab, the other one hasn't taken any vaccination. And as I mentioned just now, for the serious cases, well, we have actually one 57-year-old male patient has taken 1 jab, with another 56-year-old patient 1 jab. Now, what do they have in common? Well, they have taken the jab for quite some time. They took it in August or September last year. So I would like to call on the public to take the first dose as soon as possible. If you haven't taken it, please do it as soon as possible. And after the taking an RAT, and if you are positive, resting at home is an option. I believe that most importantly, we need to know whether it's a confirmed case. So you really need a test to do that. So if you really encounter difficulties, if you can't find family members or friends to handle the sample for you, there are services available at a charge. And at our website, you can find such services. Any supplements? Well, we have over 1,000 cases now. We are concerned whether the patients have been to high-risk places. Well, normally they would go to restaurants when they take off their masks, or if more than 1 case has happened at one place, and we will be more concerned about these places. Now, because we have now over 1,000 cases, if we ask all their contacts to be tested, then the queues will even be longer. Now you come to our press briefings and you always wear your mask, you never take it off, so we don't think you should be subject to compulsory testing. Well, they have taken different vaccines, including BioNTech and Sinovac. I'm from TVB. Now we have over 1,000 cases today. Earlier on, we were told that the condition is not out of control, but do you think it's now getting more and more out of control? Do you think we should adopt the strategy of living with the virus? And early on, you've decided that the details of the confirmed cases would not be disclosed. And some people are worried that they would only be told after midnight that their housing block has some confirmed patients. So will you consider giving more important information to the public? And for confirmed cases, now many of them have to wait for a long time before they are hospitalized, and even their family members may be affected. So do you think the present practice will put the carriers' family members in danger, and you're asking their family members to handle the sample bottles for them, and would that put them at risk? Now some people are waiting at home for the test result for 3 days. So do you think that we have to wait till the Hoyan laboratory is open before this can be resolved? Well, a reporter has attended the chief executive's press conference, and he or she was infected, but now the CE is still not wearing a mask. Would you think that? Do you think that she should be wearing a mask?
Let me take your questions first. We decide not to disclose details of individual cases, but this does not affect the compulsory testing notices. We continue to publish compulsory testing notices. Of course, with more premises involved, we need time to collate information. I appeal to your understanding. Now, if the confirmed case had been to places whilst wearing a mask, then the risk posed to other people might be lower. Now, of course, if you share a meal without wearing a mask, of course, your risk will be higher. About the arrangement of testing positive under the rapid antigen test, I understand that some members of the public may find it difficult to enlist the help of their family members. This may not be the perfect solution, but I think at this time the most important thing is that you need to have good infection control measures whenever you go out. Apart from observing hand hygiene, experts recommend taking a serious attitude about mask wearing, such as using 2 masks, using a cloth mask, and also tie a knot to make sure that your mask will remain close to your face. Another question, English question.
A question from SCMP. So first, which coronavirus variant was the 2 patients who passed away contracted with? And second, why every block in Discovery Bay is subject to the compulsory testing order? Is it the first time to conduct such a large scale of compulsory testing due to a positive sewage sample? Third, when will the authorities start isolating COVID-19 patients at home? When will the government start? So what's the occupancy rate of each facilities at the moment? How many people have the Penny's Bay had taken so far? And then and also, like, may we have the number of the people who are in home isolation? And also you have mentioned that the government is planning to open more community quarantine facilities for COVID-19 patients. How many will be open? Thank you.
Okay, so for the 2 passed away patients, I don't have a concrete information, so I probably have a written reply to you later. As for the occupancy rate, now the isolation room and also the isolation bed, the occupancy rate is approaching 90%. And for the Penny Bay, we start the operation yesterday, and now we have around 200 patients right there. We are trying our best to transfer more patients there to try to relieve the pressures of the CTF and also the hospital. We are actively exploring any possibility to have more capacity for the community isolation facility, including more blocks in the Penny Bay or maybe other facility. For the home isolation, this is a policy that probably not the only business of the hospital authority, and I think our hospital authority will actively to suit what will be the direction and the strategy.
I don't have the details of the sewage. I think it must be a positive sewage from the Environmental Protection Department that triggers the compulsory testing notice. But for human case, we do have a few human case who are working in the Discovery Bay Mall, the plaza, concerning the customer service and concierge and also the cleaners. Yeah.
問多條英文。
Another English question.
Okay, about the 2 COVID patients who died yesterday, were they infected with the Omicron or Delta variant? Did they get vaccinated? And if so, which vaccines did they receive? And what do you think was the cause of their deaths? And also, there's a number of cases involving health workers in public hospitals. How do you assess the risks of outbreaks in hospitals? Thank you.
Okay. So for the 2 passed away, as mentioned, that I don't have the information about the variant. We will pass you the information later on. And as for the vaccination, the latter case, the 16741, who has no vaccination record, and the case 17498 actually received 2 doses of Sinovac vaccinations, complete in September last year. What is your second question? Sorry. Okay. As you can see, there are some staff being infected, and actually there will be a slight increase in the number. And actually for the hospital, all the staff is performed very professionally, and actually they wear the appropriate PPE, and hence there is no patients to be influenced. So we also we're doing in the direction to try to reinforce that the staff to be separately to be separately having their tea or maybe their meal time to be individually. And actually individual hospital and the cluster, they work out some strategy and try to facilitate this. And I think the staff nowadays, they perform very well, and they trying to keep the service unaffected.
下一題。
Next question. This lady in the front row. I'm from Phoenix TV. The City University has projected that in the fifth wave, close to 250,000 people will get infected. So my question for the authority is, what is your comment on the projection? Do you have any statistics to project the upcoming trend, and how many silent transmission chains are there in the community? What is the government's estimation of the number of confirmed cases in the fifth wave? We respect the work of projection or extrapolation by experts, and I think the trend by and large depends on cooperation among the public. If you stay in and avoid going out, then the situation may ease. Otherwise, if you continue to go out and have gatherings, because I see in recent days, even after the 3rd of February, there were still gatherings. So during Chinese New Year, in some cases, some patients visited one family in the morning, and then another family in the afternoon. That means one patient would have 30 to 40 close contacts. So there would be infection among multiple households. Imagine the exponential increase in the number of confirmed cases. So if we put a stop to these activities, we'll be able to ease the epidemic. Next question. Sorry, the speaker is not coming through. I don't think we'll be able to give an exact number, because we do have silent transmissions in the community. If you go out often, if you visit crowded places, then there is a higher chance you'll get infected. Say if you have a gathering of 20, and among the 20 people, one of them is infected, then you get a chance of getting infected as well. Next question. I'm from Cable. Dr. Leung of Hospital Authority earlier believed that we should boost vaccination rate instead of using the containment strategy, and that hospital beds should be reserved for high-risk individuals and vulnerable elderly patients. What is your view? Now, about case number 17498, can you tell me what vaccine jabs the patient received? And for the elderly home with a patient who had passed away, may I know the name of this residential care home? Now, members of the public now need to wait for 3 days before the CTN result is out. Do you have any idea how many days a confirmed case has to wait at home before he is hospitalized? And will you consider requiring asymptomatic confirmed cases to be isolated at home?
Well, for different experts' views, of course, we respect them. Well, for vaccinations and quarantines, they are both very important. For the patient 17498, the vaccines he used was Sinovac. He took 2 jabs. Now, some confirmed cases have to wait for several days before hospitalization. I hope that you can be more accommodating. We are trying our best to handle the situation. We have a hotline service. We hope that we can provide assistance to the positive cases. And we are also trying our best to increase the capacity of community quarantine facilities. And we hope that we can shorten the time of transferring patients to hospitals. Well, for the elderly home, it's called Wenlun. The Chinese name is Wenlun. Next question. The lady in the middle. I'm from Dim Sunman, and I have two questions. Well, members of the public say that they have a domestic helper at home who's tested positive, but after going to hospital for another test, the helper is sent home to wait. And the hospital also asked the domestic patient to take public transport to go home. Is this true? Because this person may be a positive case, so she may be spreading the virus. Well, the government is now banning multi-household gathering in private premises. So what is the definition of private premises? Are officers included? If that is the case, then when people go to work, they may be breaking the law. Now, yesterday, I think another official has already answered this question. That is, officers are not regarded as private premises in this case. Well, when patients go to the A&E department, well, you have to understand that now the A&ED is overloaded. So we hope that you can wait patiently at home for the appropriate arrangements. Of course, this is not ideal. However, if the patient is careful, for example, if they wear their masks properly, I think this is one of the feasible ways. Next question. I'm from Yingpao. For the how many preliminary positive case do we have today? And for the elderly person that's passed away at the elderly home, what's his age, and when do you think this wave will peak, in months or in days? And for Penny's Bay, there are now 500 additional units, and 200 patients are now staying there. So will all the units be taken up tomorrow? Will you have to increase the capacity? And how many people have been deployed for community quarantine by the CHP? We have seen several cases, 14530 to 14532. They have not been sent to hospitals yet. So how long have they been waiting? Are you worried that there are still many more patients waiting at home and they may even die at home? And on some WhatsApp groups, we find that people are saying that after taking an RAT, they are preliminary positive, but they still have to wait at home. But if they are waiting at home, then they may affect their family members. So how are you going to deal with these cases? And you are not disclosing the details of cases anymore. So can you give us some epidemiological information? What's the distribution of age of these positive cases? Where do they live? If you cannot give us the reference information today, can you give us more information in the future? Well, please stop here because you have asked too many questions already. Maybe I can answer the questions first. There are about 800 preliminary positive cases. And if you go to our website, and if a person has been hospitalized, then we will put the information there. And if you cannot find the information, maybe he's still at home. Some people have to wait for several days. For home quarantine, as of 12 midnight last night, we have 606 people who are now being quarantined at home, and they have to be quarantined for either 4 days or 14 days. As for the details of each case, we are not going to disclose them anymore. As to whether there are people with symptoms, you can see the figures on our website. For the confirmed cases, they are those showing symptoms. And for ages, well, maybe we can try to find out the distribution, but it will take some time. For the case 17498, the elderly male patient was 73. As for our isolation units, we have 500 to 600 rooms at Penny's Bay. Now we have 200 patients there. We are making arrangements for them, and some of them, several family members live in one unit. And we are working in two directions. First of all, we will amend our discharge conditions so that our patients can be discharged earlier. In the past few days, we have been doing a lot of improvement work so that patients can be discharged more smoothly. And we are now trying to identify more community quarantine facilities so that the patients can be sent to them as soon as possible. Now, all our health workers in public hospitals are trying their best to take care of the COVID-19 patients. So I hope that members of the public can cooperate with us and try to reduce your social activities. I'm from AM 730. For HA or the Department of Health, have you thought about the future trend? Do you think that in the near future all the confirmed patients would have to be home quarantined? And when will the new discharge policy be implemented? As for the Penny's Bay or for the new quarantine facilities, where will they be and what will their capacities be? And for the Wenlun elderly home, does the case 17498 lives there? And what's the number of untraceable cases, or there are too many? You can tell us. As for wives and retirees, they would go to shopping malls and markets. Well, how long do they stay at such places? And do you find any common points in them? And are the cases concentrating in certain areas or districts? Now, for the new discharge arrangements, now is already been implemented. So for the number of patients that would be discharged, it will definitely increase, and it now is smoother. As for the Penny's Bay community quarantine facility, we have 500 to 600 units there now, and phase 2 will be open soon, but I don't know the exact figure yet. Well, we are not making projections concerning case figures in the future, but we'll try our best to do a good job. As for one home for the elderly, yes, that is the case 17498. This is the place where he's staying.
As of yesterday, we recorded 1,400 plus untraceable cases, but a phenomenon has emerged, and that is for untraceable cases, they usually concentrate in an area. So if there's an outbreak in an area, then people who have visited the shopping malls, markets, etc., and neighbors who may be living in the adjacent block may be affected, and these may be connected cases. They may have been infected in the same wet market or in the same shopping mall, albeit being called untraceable cases. So this usually happens in areas with an outbreak. For example, we have more untraceable cases in Sham Shui Po, Kowloon City, Wong Tai Sin, Yuen Long, Sha Tin, Kwun Tong, Kwai Ting, Tuen Mun, Tsuen Wan, Tai Po. We have lots of cases in these areas. The speaker is not coming through. Well, many cases require further investigation. This is only a preliminary figure. But of course, many cases are in fact coming from the same family. They are from the same cluster. There may be other untraceable, unlinked cases who actually live nearby, who have actually visited the same places. And there are spreading of the virus in the same workplace, on the same neighborhood. 2 more questions. I'm from Economic Times. Good afternoon. About untraceable cases recorded yesterday, may I know the single-day record? The other question is this. Among the 1,000 plus cases, can you have give me an estimate how many of these cases are actually linked? Now, you mentioned about 10 elderly care homes with outbreaks. Do you have any idea about the percentage of elderly residents who have been vaccinated? The other question is this. About the 606 people put under Stay Home Safe scheme that is under home isolation, may I know the districts they reside in? And a question for the HA. 69 healthcare staff have been infected in the past 3 days. You just mentioned that you have exceeded capacity. Is it that it is difficult to operate the hospitals now? Does it affect your operation and staff morale? If we continue to see over 1,000 cases of infection every day, will the situation get worse? About Penny's Bay, this is a point of clarification. Is it that if a patient is confirmed, then patients from North Lantau Hospital and the Infectious Disease Center will be transferred to Penny's Bay directly, or what actually is the operation? Will it cause a delay in the process of transferring patients? Now, for positive cases that may form crowds at A and E units, will you have a separate area for them to avoid cross-infection with other non-COVID related patients? Yesterday, about 500 cases are untraceable cases. By untraceable, I don't mean we have no clue at all. It's just that we cannot really assign a case number showing the epidemiological link. The source of infection could be the shopping mall or the buildings nearby which they visited. The 600 plus people under Stay Home Safe live in all 18 districts in Hong Kong. Now, for Penny's Bay, your question is whether symptomatic patients are transferred from North Lantau Hospital, Hong Kong Infection Control Center. The answer is yes, for a start, but then we will also begin to take patients straight from the community. In fact, we've just begun receiving patients referred directly from the A&E units in hospitals. We do have experience. Previously, we were able to separate high risk and high infectious patients from others. We call it TNT, and these patients would be separated and directed to stay in areas with good ventilation outdoors. So we have a facility, and there is no risk of cross-infection. You mentioned the HA staff getting infected. First of all, they got infected in the community. There is no spreading of the virus in our public hospital system. Despite the increase in the number of infected staff members, they've been reminded. And since then, there have not been many close contacts as a result of them not observing our social distancing requirements during meal time. Now, we have indeed fewer staff members available, but we'll continue to remain steadfast and try our best in our position. Last question. I'm from InMedia. I have 3 questions. Do you expect the healthcare system to exceed its capacity in a few days? And for confirmed patients, how many days will they have to wait before they are sent to hospital? Will there be a plan not to send them to hospital? For Leung King House of Leung Kit House in Leung King Estate, Tuen Mun, are there any news when the RTD operation will come to an end? We do not have any figures in this regard, but indeed we appeal to the public's understanding that a confirmed case may need to wait for a few days before they're admitted to hospital. We will try to increase our service capacity, and we have revised the admission guidelines. And more importantly, we appeal to the public to reduce social activities, to target the problem at source. Now, we tested 1,623 specimens with 13 samples tested positive, affecting 12 units. But they are they scattered throughout the building, and there could be transmission going on within the building. That is why we need another night of testing. A speaker is not coming through. The speaker is not using a mic. I'm not quite sure which case you're referring to. We're going to trace every case, and if indeed there is any activity involving the mask being taken off or any close contacts, we will follow up on the matter. Yes, definitely. It depends on the public's view on the matter. That's the end of the press briefing.